Okay. Well, good evening, and thank you all for being here. And for those of you watching live or taped, this is the City of Everett Safe Community Council Committee, and I'd like to welcome all of you here, and I'm very thankful for your interest in such an important matter here in our city. I'd like to introduce all our attendees. Instead of just kind of going around the table, I'll just kind of take a verbal attendance. So on my right is Chief Templeman, thank you for being here. Staff member Julie Willie, Fire Chief Dave DeMarco, our honored mayor, thank you for being here. And then Hill Kamen, welcome, thank you. It was the first time we met tonight, that's great. And then, of course, my co-chair, thank you for being here very much. And we have one staff member that just stepped out for a minute. That's Lori Cummings, she'll be here in any moment. And then Council Member Fossey is absent today. So we'll go ahead and get started. We do have an agenda. For those of you online or can see our agenda item, our first one is discussion over restriction of controlled substances and use in public places. So to begin with, I would like the mayor to begin.
Yeah, before we dig into just that first one, I just want to talk about, in general, the package of public safety ordinances that we are bringing forward to you. And Council Member Schwab, I know this has been very important to you. We've had multiple conversations about it, and I know Vice President Toohey has been passionate about this issue as well. The goal of the ordinances around restriction of controlled substances and service facility buffer zones, as well as ordinance that's coming before council this evening on restriction related to obstructing public works workers, is to put more tools in our toolbox as we kind of balance the issues that we're seeing on the streets and how we have the compassionate approach of getting people treatment and services, but also enforcing against behaviors that are causing significant harm in our community. And so trying to get a few tools. And so just a quick reference. And I'm sharing the one that's coming forward this evening because it's part of that package. So obstructing a City of Public Works employee, that's going to provide us a mechanism to protect our public works staff that are engaged in public health and safety tasks when they're working on cleaning up areas where people are obstructing the right of way. So that's a very important part of this toolkit. The ordinance that we'll be discussing in this committee around the controlled substance use is other cities have enacted this locally. It is really going to give police the authority to enforce against those who are knowingly using controlled substances in our community in a way that our current laws at the state level don't allow us to do. So this will help us do that. And then the second ordinance that will be discussed as part of these tools is the service facility buffer zone. And there's a lot of facilities that provide treatment and housing in our community that are vital to our community, but they also, a lot of these will cause street level social issues, nuisance, criminal activity, open air drug activity that impact both the individuals that are trying to safely seek services, as well as the residents and businesses surrounding that. And so this ordinance is talking about a buffer zone to create a safer environment for those seeking services. And with that, I'm going to hand it over to our expert team, and I'll kick it off to you, Phil.
Yeah, thank you. So let's because the mayor kind of covered the whole group here. So let's begin by focusing on the controlled substances use in public places. So there was just kind of one comment I wanted to make about this. We're not the first city to enact this legislation. My understanding is Tacoma has gone through this whole process, and they're a like community that has really willing and been very graceful to its people in need and providing a lot of services, and they have seen this as a very effective tool in keeping the community safe and encouraging the use of these facilities. So, go ahead, thanks.
Starting with the controlled substance one, is that better? There we go. This even closer to home, the city of Marysville has a like ordinance that they have been using to great effect. I know the chief can speak on that. As you're probably familiar, there was a court case a couple years ago, the Blake case, that got rid of possession of controlled substances as a felony crime. It left a big gap in our ability to enforce against these crimes. Since then, the state legislature has done what was called the Blake Fix, which was a temporary attempt to try and legislate some more ways to both provide services and allow municipalities to enforce. It still has left some gaps, and so cities have passed similar ordinances to try and fill that gap. And what this does is allow our police department to enforce against people who are using illicit drugs in public places, out in the open. This kind of activity is something that is a high priority due to the number of community members that bring this to our attention. It's visible. It creates all sorts of ancillary problems, including theft, litter, public safety hazards. And I just want to say, as a practitioner in the municipal court of criminal law, and I'll look to the chief also to speak, I cannot think of an officer, an attorney, a judge who wouldn't rather see everybody get into treatment than put them through the criminal justice system. I think that is everybody's goal. The reality, and the city, has done, along with other partners, an immense lift to increase treatment capacity. And I do believe that for people who want to get into substance use treatment, those services are available. There are people who can help you when you want that. But there remains, despite all that effort, a population of people who do not want to be in treatment and whose use of these drugs is having a negative impact on our community. And this ordinance is a tool that would allow us to be able to address that, particularly until such time that the state acts to legislate this in a way that is effective. So there are bills pending, but we don't know what and if any of those will pass. And so we're asking council to look at an ordinance that we provided in draft copy tonight, but it says draft, but it is what would be presented to council at a later meeting.
And Chair Schwab, I just want to add, it's not, I'm going to correct Hill just gently. It's not that people don't want treatment. They are so addicted to fentanyl that they can't possibly make that decision. Their fentanyl is very different than any, so for any of our community members that don't know, it is so different than any drug that we've ever seen. It is 10 times more addictive than heroin at minimal, and it takes that much longer to come off of. And so we cannot expect somebody who is high on fentanyl or addicted to fentanyl to make a choice to get treatment. There has to be a tool to kind of get them clean and sober enough where they are able to make that choice. So it is a disease, it is a challenge, but we don't have any tool, and these folks are really literally dying on our streets. So thank you.
Yeah, I just had a couple of questions. Would this apply for somebody on a transit bus?
It would apply in public places, so it would include transit buses in the city of Everett.
Another thing, a question, and maybe this is for the chief, is the department, what expectations and maybe responses have you been preparing for this ordinance to pass?
Yeah, thank you. Well, we're prepared, obviously, to administer this ordinance if it were to pass. I think what's really important is that, and you've heard it spoken by the mayor, that this is just another tool in the toolbox. And so by passing an ordinance like this, it does not mean by any means that our officers are going to stop referring for services. It doesn't mean that we're going to make an arrest in every situation. We may still issue warnings. We may cite and release, and obviously we have the authority to make an arrest if the situation warrants it. So to the degree that our staffing and call load allows us to respond to these types of calls, we are prepared to enforce it and apply it appropriately if it passes.
Yeah, I have a question. So, okay, so you arrest someone, walk through the process of what happens after that point. How many days what they go through, some idea.
Are you saying it in a hypothetical
Yeah,
under this ordinance? Let's say if
right.
this ordinance were
Yes.
to pass. If this ordinance were to go into effect, you know, I gave you some of the options that our officers would have at their disposal in terms of making an arrest and exercising their discretion. If we did arrest and book somebody into jail for this offense, they would be processed through the jail. I will note, and I think it's important for the community to understand that the jail here in Snohomish County does have medication-assisted treatment that individuals that are suffering from substance use disorder can engage in at the jail and get treatment started at the jail. But typically, you know, as a misdemeanor, and I think Hill could answer this as well, typically, you know, those individuals may spend, you know, a few days to maybe 10 days in jail before arraignment. It's less than that for arraignment. Some may be released. I mean, that's up to the judge. So it's possible that they could end up back out on the street. But at least this does provide relief to, you know, business owners, residents, and does provide an opportunity for an individual who is booked into jail to maybe clear their head a little bit and gives them that opportunity to engage in meaningful treatment. Because again, it is offered at the jail, and sometimes it's very difficult to get that type of access in the general community, unfortunately, right now, until more robust services are available community-wide.
I'll just share, earlier this week, I was covering the jail calendar, and a young man, no older than 20 or so, was on for arraignment, and his mother was in court, and she was begging me to please hold him in jail because he is so addicted, and she has tried to get him committed civilly. She has tried to get him into services. She's tried to get him into treatment, and she is afraid that he's gonna die out on the streets. And her hope, she was asking me, please hold him in jail so somebody could help him start down this process. And so these are, you know, these drugs, as Mayor said, are impacting individuals and families that in devastating ways. And the jail still remains a place where we can provide that immediate relief to the community, the business owners out in the public. But, you know, where all the other options fail, it does provide us an opportunity to give a person access and an opportunity and exposure to the kind of treatment that the jail has. So, you know, this ordinance, it fits in with all our other options, and then they would be as part of the regular criminal process where they would be appointed an attorney. If they can't afford one, they would have an opportunity to argue for release or bail, and they would have all of the rights that are afforded to everyone who is in the criminal justice system.
Thank you. Julie, did you had your
Well,
mic
I
on?
just wanted to, like, remember our residents who also are going to the grocery store, walking on the sidewalk, or sitting in a restaurant and then experiencing, you know, seeing people do open-air drug use, and just the concerns that we have for them as well. And I read an article recently that likened it to the fact that we can't use open-air alcohol, and that's legal. We can't use marijuana in public places, and that's a legal substance. Yet we're allowing controlled substances to be used on our streets. And so, to me, that made perfect sense why this ordinance might be, you know, a logical tool.
That's a really good point. Thank you. I appreciate that. Mayor, you want?
Yeah, just one more thing. You know, we have great partners in the city, like Ideal Options and others, that do medically assisted treatment like we have available in the jail. And so we can get people who are seeking treatment on demand. But what we don't have, that the jail currently is one of the best providers of, because we don't have enough treatment centers, is that start into treatment where they're secure, where they're not being exposed, no one's handing them their next fix. They're actually safe for that's why the mom was begging. They're safe inside for a few days to hopefully get sober enough that then when they're released, they can engage in the treatment options that we do have available that are not inpatient, while we as a state hopefully develop a lot more inpatient treatment options.
Chief DeMar, go ahead.
I just think that's really interesting point that the jail provides that. I wasn't aware of that, because I know a few years ago, they didn't want anybody in there who was drug abuse, because they didn't want to handle it. So that's great. That's really, it's important for us to know on this.
Chief DeMarco, I was wondering if you had any comments about maybe how it affects the fire and EMS side of things.
I don't have any prepared comments, but obviously the police and fire department work very closely together in treating the patients, particularly those with addiction and recidivism and in overdose, and that the pace of those incidences has been increasing over the years. And I am also in favor of any additional tool that we can offer to help these people arrive in a place where they can be led to treatment. If that's necessary, then that would be ideal.
Thank you. Thank you for letting me put you on the spot, too. I know you like that. Any other, yeah, go ahead, Chief.
Yeah, Council Member Schwab, I just had one more comment, and I know that for both of you as council members, that you receive the emails and the phone calls and the communications about just how rampant this open-air drug use issue is in our community. But just, from a data perspective, and again, this would be looking at just what we call our substance calls for service. So it could be an overdose, it could be somebody who's using drugs in public, it could be somebody, somehow it's related to drugs, at least the caller it believes it is. That we respond last year in 2022 to over 3,000 calls for service. So that's about 8.3 calls per day in Everett regarding substance. And again, it's not just necessarily open-air drug use, but that's a 56% increase over 2021. And we're on pace this year to see about a 65% increase over 2021, and our highest number of complaints, calls for service, again, calls for service related to drugs in the last 5 years. So, not only are we seeing it and feeling it, when we walk down the street or when we hear from constituents or residents of Everett, but the data also bears out that we've seen an exponential increase in just the last couple of years. Thank you.
I appreciate that. Thank you very much for that. Any other comments from staff? Okay, well, how about we go to our next agenda item, and that is the service facility buffer zone.
All right. This is another ordinance in those package of ordinances to try and help address a similar issue, and we hope to have a draft to you shortly to get on the agenda soon. This really is an effort to try and support those providers in the community who are attempting to give treatments and housing services to this population by creating a buffer, a 2-block buffer around where those services are provided. And what would be prohibited within that buffer zone is sitting on the sidewalk, laying down, setting up structures within that 2-block radius. One of the things that we have noticed is that there is a cluster of this kind of open-air drug traffic, street-level social issues that occurs within the vicinity of those service providers. And so in order to help assist those providers and also assist those people who are trying to get services there so that they don't have to walk through a gauntlet of people using drugs out in the area or surrounding where services are being provided. We're proposing an ordinance that would create a buffer zone around a qualified service provider. It will also, in our proposal, allow, so those would be automatic because of the nature of the services provided there. We're also proposing a way in which to designate other addresses as sort of high concentrations, and then the buffer zones would apply to those areas where we have a record over time showing that there's a high concentration of drug activity a high number of complaints from the community. We know that this activity tends to concentrate in certain locations and that it then may move over time to different locations. And so for these locations that would be reviewed on a regular basis to make sure that administration is setting up those buffer zones in the parts of the city that are most impacted. We believe that an ordinance like this can be very effective in supporting the services in that area. We have this other ordinance that was set up down by the Smith Avenue, and it has been very effective in allowing the gospel mission and the pallet shelters to provide the services there without creating a cluster of drug use, shelters, and activity within that zone. And so an ordinance like this that creates those buffer zones is another tool to be able to support the service providers who are helping us to increase that treatment access in our community.
Thank you. Yeah, go ahead, Julie.
Well, I think that it's been recognized that we have a lack of shelters, we have a lack of services for people in our community that need resources and access to services. And we are trying to use our ARPA dollars to add a day center, and also our county is trying to add shelter to provide overnight care and services to our population. And in doing that, there's community concerns that there will be problems that are associated with it. And we're working extremely hard with the county and with the service providers to talk about management plans and safety and security and ensuring we have the necessary infrastructure so that the sites are sound. But in addition to that, we want to be able to assure that the neighborhoods that were also potentially impacted, that we're watching out for them and that we are going to ensure that they are too protected and to appreciate them actually for allowing the good services to be in their neighborhood. This gives us a tool to say we need to do both. We need to have shelter, we need to have services, and we need to ensure that our businesses and our residents aren't negatively impacted. And I believe this ordinance can do that. And as Hill mentioned, the pallet shelter came alongside of a similar type of ordinance, and those businesses down there praise the fact that they have that ordinance. I had one business told me that that ordinance was the best thing that happened to his business in 40 years. So they really saw it as a benefit, and they also had compassion for the individuals. So they really wanted to see them in shelter and to get the help that they needed, so.
I had several questions. I don't have the ordinance here in front of me, but would this include the potential future women and children's shelter there and the two that we're working, including the
Yeah.
Faith Lutheran?
Like Hill said, the ordinance could be defined as a certain type of service, like a shelter, an overnight shelter, a day shelter may be included directly in the ordinance. So that would fall under that definition.
And I also want to make a comment, kind of a repeat earlier. This isn't we're not the first city to Tacoma. We really like community and their compassion and they have quite a few facilities. I think at least 10 was the last that I heard from the mayor. And they think it's a very useful tool. So it's good to have that kind of experience to compare to.
Yeah, I just wanted to, I'm pretty sure that the Salvation Army stopped their feeding program in downtown because it was so violent. And so, the neighbors, I know that was a huge area of concern for quite a while. So if this can help those services, one thing would be helpful for me to see the list of services sites, maybe a map of Everett that would show us all the areas that would be covered under this proposed ordinance would be great.
Yeah, I'll just say we'll definitely do our best. Sometimes, we've often tried to get that full list of services for Everett, and since we don't control all the services that are funded, right? They get funded by all these different entities. But, it's like our overnight shelters are where people are experiencing that in and out services. This wouldn't apply to permanent supportive housing or affordable housing or things like that. This is shelter and those high intensity services that serve a very a population that needs a lot of support, and where, as Hill explained, we have this this other population kind of popping up around that's making it not only not safe to seek those services, but also very unsafe for the community around those services. So we're trying to both increase the safety for the people seeking services and increase the safety of the community where services are located. And so, yeah, we'll do our best to get a map. I don't know, I can't promise 100% accuracy, but we will very much do our best.
So would a service organization apply for this, or you just have them all logged out? You know who most of them are?
Well, we're actually doing quite a bit of work around understanding what service providers are where and if they're aligned. You know, we've got some new zoning changes recently, and so we want to be able to educate our nonprofit partners about kind of if you're in compliance, if you're not. You know, there's a lot of things that we're doing. We do have some maps, but like the mayor said, it may not be all encompassing, but we're certainly trying and taking it a next step as to what else do we need in our city to ensure that we know what services are being provided, who's providing it, where they're providing it, do they have the proper permits and such. So that's another body of work that we're doing kind of alongside of these ordinances.
I guess I had a question about the size of the buffer zones. And some of the properties of some of these facilities we're looking at are quite large, like the Women and Children's facility, potential at Glenwood and Sewers Ducey Road. That's a huge piece of property behind it. Would it include that, or is this a distance thing? Could you be a little more specific? Also, I was just thinking of the Days Inn, where it's actually adjacent to a large Department of Transportation property, and how that all fits in. Thank you.
Yeah, and these are great questions, and they're the kind of things that has made it challenging to draft an ordinance because we are trying to make it narrowly tailored to focus on addressing the problem while also, preserving all of the rights that our community members have. What we settled on is a 2-block radius from the locations. And we're hoping to really just mark out a buffer zone that is large enough to really cover how people use those locations. They tend to come and congregate within a couple of blocks of where those services are being provided without drawing in a large enough area that we couldn't connect it to the location. So we settled on 2 blocks. In all directions. So it would cover whatever location you can think of from the edge of that property. 2 blocks out would be the length of the buffer. So they're going to be, depending on the size of the property, if it is a whole city block, obviously it's going to extend out another block.
Thank you. Do you have any more questions? Okay, very good, very good. Thank you for those 2 presentations. Well, so agenda item number 2, our custody transfer discussion. And I guess I'll just start off here when this is brought to our community and some other groups about the use of our emergency and fire services when they are transferring a patient to the hospital from our care. And we've asked Chief DeMarco to do a quick presentation on this issue. So I'll hand the mic over to you.
Thank you, Chair Schwab. There's some handouts coming around, and forgive the basic introduction, but just for the benefit of everyone, the fire department in Everett serves a variety of emergency response purposes. The 2 largest purposes being, of course, fire suppression and emergency medical services response, or EMS. We've been providing that service for decades and do it well. And we have years and years and years of data. And so the ask that you placed on us was, could you please give a historical perspective on how have transfers of patient care from EMS to the local hospitals occurred in the past, and how are they occurring currently? And are there any trends? And so in the handout package in front of you, the first page really is just a description of the service we provide with a few caveats about the data that we're presenting here. We've only had about a week and a half to work on this, and so there are some limitations of what I'm about to share with you, and they're outlined on the first page.
Go ahead. Just wanna make sure.
So if you flip to the first exhibit depicts transportation of emergency medical patients to the hospital, not just, in this case, Providence, and then in some of the upcoming data, all hospitals in the county. And the number of transports per month, so this is broken out by month and by year. And the volume of patients is the height of the bar, and then the amount of time it takes to arrive at the hospital, make the connection with staff at the hospital, explain what's wrong with the patient, what action has been taken to intervene in their crisis, and then have the hospital take over responsibility for the patient, is the period of time that we're talking about here. And in our historical system, that entire process, so from the time you call 911, we send a unit, they evaluate you in your home or wherever you are, they treat you to intervene with whatever the problem is, we transport you to the hospital, and we transfer care. And the transfer of care has typically been the smallest part of the work that we do. It's sort of taken for granted that that process at the hospital is very speedy. And what you're looking at in the first graphic there is a depiction of blue is what we would consider a normal period of time, and then the colored times are times that are becoming increasingly long. And that'll take us into the next chart. And on page 3, we do a little bit deeper dive into the manner in which people come to the hospital and the length of time it takes to transfer them. So in addition to taking people to the hospital, when we triage them, we have to decide how serious the problem is. And if the problem is life-threatening, then they are placed in a paramedic unit, and paramedics are equipped to make life-saving interventions with medication and procedures. The same work that goes on in the hospital, that goes on in the back of the paramedic unit, and are transported to the hospital and paramedic unit using advanced life support skills, or ALS. In the chart here, the blue lines are all of the Everett paramedic units and the amount of time that it takes to transfer a patient to the hospital in blue for ALS. Everett also, both Everett Fire operates 3 aid cars, which are equipped with EMTs, and they do basic life support, and we also contract for service for basic life support transport to the hospital from Northwest Ambulance. And the combination of Northwest Ambulance and Everett Fire units are also transports to the hospital, and it's important to note that the less critical patients are transported BLS to the hospital. And basically what this chart is showing you is that the transfer time is much closer to historic normal for the paramedic units than it is for the aid cars. And that's sort of the purpose here. Northwest Ambulance is not depicted in this chart.
So, Chief, there, real quick here, it looks like we're making some real big improvements on this at this point.
We are.
Or I should say it's a combination team between the hospital and the fire and EMS.
Yeah, at the very end, I'll take you through where we've been and the work that we're doing with the hospital, and the results that we think that we're seeing. Okay.
Fantastic, thank you.
The next page is basically a histogram of how long does it take to transfer people. And the reason there's nothing on this chart is you asked me to take it out to 3 hours. And so the depiction here is really to show that the vast majority of the transfers at the hospital, and this is during the period of time that we consider normal, 2019 to 2021, occur in a reasonable period of time. Typically, we transfer people to the hospital in 45 minutes or less, 90% of the time. And that's essentially what this chart shows. And it essentially shows also, if you read the fine print there, that over that 3-year period, only 29 cases took more than an hour to transfer. So the period of time that we're more interested in is on the next page, and this is 2022 to date. And it was 2022 where things start to change at the hospital. And again, there's not a lot of graphics on this page, but we took it out to 3 hours again at your request. And you can see in the very, very tiny fine print that there are now a significant number of cases that take in excess of an hour to transfer to the hospital. And obviously I can provide you with the exact counts on that if you're interested, but in the fine print there, over the last year and some change, we've now had 337 cases out of about 4,000 that took over an hour to transfer. And now to the very last page. And forgive me, I don't like to publish complicated charts and tables.
Yes, you do.
You're very
try
good
not
with, Chief, I really appreciate, you're really good at it, so thank you very much for
But
what you do.
but this is a complex problem, and does not have a simple one-line solution. And so on the left-hand side of the page, the table and the chart are for the paramedic units, and on the right-hand side of the page are the basic life support units, both Everett Fire Aid Cars and Northwest Ambulances assigned to Everett. And the top chart is asking how many times, because what you asked in advance was, how often are multiple units stacked at the hospital? And so what the chart shows is a count of cases where there are no medic units at the hospital, a count of cases where there is one medic unit at the hospital, a count of cases where there are two medic units at the hospital, and a count where there are three. And this is for a 4-year period of time. And essentially, the top chart there is showing you that for the paramedic units, even though there has been somewhat longer transfer times, it has not impacted or statistically significant way changed the number of units stacked at the hospital at any given moment. And so the table down below is not counts, it's time. And what it's essentially telling you is that across the same period of years, there are no medic units at the hospital for that top row, and in 2022, that was 86% of the time. There was one medic unit at the hospital 12% of the time. There's two medic units at the hospital 1% of the time, and then all three were at the hospital less than 0.1% of the time. And then the number of cases that's based on is the count that's at the bottom there. Of more interest, and the place that I think that you are interested in is on the right-hand side of this page, and that is the transfer time of basic life support patients to the hospital, the less severe patients. The call volume here is much higher. There are many more subacute patients than there are acute patients in the community. And over this same 5-year span, particularly in 2022, and I've highlighted in the table below, which is describing time, and it's also charted in the table above, which is describing counts, but the number of times the 3 aid cars and the 3 Northwest ambulances assigned to the city of Everett are stacked at the hospital. And while it doesn't look like a big change with the red line over those yellow lines, that the space under that line represents a significant number of calls and a significantly longer period of time that aid cars are parked at the hospital. And then the highlighted portion in 2022 in the table below is sort of a depiction of, if you compare 2021, which is more historic normal, to 2022, we had no aid cars at the hospital or ambulances at the hospital 70% of the time, and in 2022, only 60% of the time. So we've invested a significantly larger amount of time in the hospital, particularly for the basic life support units. So that leads to the question. I hope, maybe I'll stop there and see if you have questions.
I was hoping Chief Templeman had the opportunity to share if we're seeing long wait times with police too before Chief Marco continues.
Yes, unfortunately, I didn't have the opportunity to put together tables and charts like this, but I'll take a lesson on this one from the fire chief. But the answer is, and I don't have the data, but we have had the opportunity to meet with our operations sergeants, and they've noticed in the last year a significant increase as well in officer wait times at the hospital. And really how that happens, a little bit different than fire, is we're required, we know, for example, for collisions, we need to get a clearance to book if somebody's arrested for DUI collision before we can take them to the jail. The majority of police officers on the street, why they end up at the hospital with an individual is that we're booking them into the jail, and jail medical staff says we're not taking them unless there's a clearance to book them into the jail. So we've seen, number one, a notable increase in the requirements from the jail to get that clearance to book. So that's one factor that's impacting our officers. And then once they get up to the hospital, on average, what they're seeing now is anywhere 2 hours would be good. On average, it's between 2 and 4 hours that at least one officer, and again, if we've got multiple clearance to books occurring at the same time, it'll be multiple officers. They are at the hospital, out of commission, unable to respond to other calls for service for 2 to 4 hours on average. Been as long as I've heard 9 to 12 hours, but the average is between 2 and 4 hours. And again, we could probably obtain better data on those numbers. It would take quite a bit of work, but that's just anecdotal from our interactions with our patrol sergeants.
So real quick question about, they were considered BLS patients then, or, right?
I think it's different.
Basic life support for anyone listening.
No.
So it's a
Sorry.
little bit different when police transport someone to the hospital for clearance to book, but in general, if the officer has a concern that there is an acute medical issue occurring, then they will ask us to come and evaluate them. And if there is actually an acute medical problem, we will transport them. And so by definition, the patients that come in a patrol car generally are subacute. They're not critically ill.
Thank you. And you had some other comments.
I
You
was
wanted
going to stop
continue?
and see if you had any questions before I go on.
Any questions? Okay, good,
Okay,
thank you.
so a little bit about what we're doing. Mid-2022, we realized that if you look at the 3 prior years, particularly during the pandemic, we, the community, not just Everett, but all of Snohomish County, anticipated this overwhelming onslaught of patients at the hospital. And it just didn't quite occur. We built temporary medical facilities, we occupied Angel of the Winds, we were prepared for this overwhelming of the medical system. What we didn't see coming is that at the end of the acute phase of the pandemic, as it became endemic, that the vast majority of the baby boomer nurses decided that they were done and they retired. And the pace at which they retired was completely unexpected, not just in Everett, but in all of Washington State and across the country. And the educational system for registered nurses cannot make nurses as fast as they were retiring. And so now there is a nursing shortage across the country, in Washington State, and in Snohomish County. So in 2022, the number of nurses available inside the local hospital system declined. And if you track the counts of patients that were transporting people to the hospital, that in 2022 they picked back up and actually increased by a significant percentage. So demand on the system is higher, the available caregivers is lower, and so you start to backlog inside this medical system. None of those things, the EMS system, the fire chief can impact. However, as patients move through the hospital system, they typically enter through the emergency department, they move up through the hospital based on the level of care that they need, and then they're either discharged or they're placed in skilled nursing. Then the skilled nursing facilities face the exact same shortages, except that they're not a hospital and they have the right to say, no, thank you, we're not taking any new patients. And so patients backlog inside the hospital. And eventually they back up down into the emergency room, and they essentially use the emergency room as a hotel for patients waiting to move up through the system and out of the hospital. All of this with less nurses. The question that I think you're getting at as we discuss this is, what is the impact of public safety, both in Everett and around Snohomish County, as more and more EMS and fire service providers are spending more and more time at the hospital? I've been to the hospital during peak hours. I've visited with our crews. I've never seen anything like it. I was a paramedic in this community for a decade, and I've never seen patients stacked up in the hospital the way that they have been this last year. Not for valiant efforts on the part of everyone working both in EMS and in the hospital, that everyone involved is doing everything they can to be successful. There's just not enough of them. And so if you follow the charts, you can see that times got worse and worse in 2022, that by the end of the year, late November, December, and January, we saw historically bad times. This is where you start talking about 2-3+ hour transfer of care times, and a large portion of the regional fire service stacked up at the hospital. We started meeting on a biweekly basis with leadership at Providence in October. We've been meeting with them ever since. We have a great working relationship with their leadership team, and the decline in transfer of care times that you see is largely a result not of those meetings, but of the hospital doing everything they can to bring more nurses on board, including spending millions of dollars on traveling nurses. And I know that there's a labor dispute going on inside Providence, and the fire service is not a part of that, but the work that goes on inside the hospital spills out, because as our units are stacked up there, the people that are calling, don't stop calling 911 in the meantime, and this whole cycle sort of backlogs. They're having success hiring nurses. They are having success in reducing the rate at which EMS units back up at the hospital. We've worked with them on a variety of things. We have another plan coming into place here in April, where light duty EMTs from Northwest Ambulance will come over to the hospital during peak hours and monitor multiple patients at a time, the subacute patients. All of this to say that while we don't have a ton of negotiating leverage, that the hospital really has been working very hard with us to both measure this problem, report on the problem, and be creative about trying to solve it. And we are trending in the right direction. We are not back to what I would call historic normal, but we are encouraged by the direction that it's headed.
Excellent report. Thank you very much. And I do think it's important as a city that we continue to monitor how much of a load that we're, as a community, support. It's important that we support the hospital. Obviously, it's a key component of our city, of our public health. So I appreciate you continuing to work with them, and hope that I'm sure that we'll continue to monitor. And if there's things as a city council that we can support you and your staff, I'm sure we'll keep working together on this. And thanks for bringing it to the forefront. And Chief, I would, if you want to spend the time on your numbers, maybe some, or just work with Dave on his charts at some point, no hurry. We know we don't necessarily need your figures to know that you're challenged with that problem. So just keep us briefed on the issue. Thank you. Do you have anything else?
Yeah, I just want to thank Chief DeMarco for working so closely with the hospital. I think that's the best way for us to get through these challenging times, and really appreciate your leadership on this. And I don't know if Chief Templeman visits with them also, but you guys are both do a great job of leadership of for our city. Thank you.
Staff, Mayor, did you want to make any comments about any closing remarks, anything that we've covered? Okay, well, we do have one more subject, and it's more about priorities, where we're going future with this committee. And at this point, I'd like to wait until we have our other council member with us to discuss that. I think we have time to work on those issues. Yeah.
Question for you. I know in moving these ordinances forward, do you yet have a sense for when you'd like to move these forward to full council?
Well, at this point, are we talking about putting them on the agenda for the first hearing on next?
I'm sorry, I'm going to jump in.
Okay, go ahead.
I'm hopeful that we can move them forward as quickly as possible. I've asked staff to expedite, obviously be thorough, but expedite the draft of the one that we discussed, but we didn't have a draft in front of you, the service buffer. Ideally, we're bringing them together because they're part of this package. We have the first of the package today for you, which is the interference with a public works employee. But the other two are necessary too. They're kind of all part of the same toolkit. So it would be my hope that we could have them next week, the week after to you, but I guess it's up to you if you think they're ready for the full council.
Well, I think they are ready, to move forward with it. I think it's really important that Councilmember Toohey and I make sure we engage the council, and that not wait till the last hearing, but engage on these issues right away, so.
So we can schedule the first reading and briefings on the two ordinances that we were talking about today, April 12th, so 2 weeks from tonight.
That's great. That'd be great.
I need to confirm staff availability, but I think we already had a sense that was going to work.
Okay, and that'll be a briefing on both of them.
Yeah, I assume you would want a briefing.
Yes.
And first reading for both.
Okay, and then would you maybe include a map at some point with that briefing?
Yeah, we heard that, so we will get you the best map that we have prior to that briefing as a follow-up for this committee, and then we would, of course, provide it in the briefing as well.
Right, perfect. Okay, is there anything else here to come before the? Okay, well, I guess that will conclude our committee meeting, so thank you very much.